Now we move on to the art of history taking. The history taking makes an important pillar of clinical examination, and without a proper history, it is very difficult to reach to a clinical diagnosis of a patient. History taking is an important pillar of clinical examination. History should be recorded in patient's own language, and too much cross-questioning should not be done. Having recorded patient's data, important points to note are history of present illness, history of past illness, family history of any diseases, patient's personal and social history, then drug histories and history of allergy. Now, it is very important to stress here that while taking a history from a female patient, it is important to know her obstetric and menstrual history, which we usually forget, because that can give us a lot of clue. Having said that, sometimes you have to ask questions which are called negative data. Now we go on to an important aspect of history taking, which is the negative data. And then we inquire about the systemic review, which has been narrated in detail in the text itself. Having said that, sometimes you come across a patient who is either hostile, is uneducated, is confused, is demented, and sometimes it is very difficult to take history. I have tried to highlight and give you some important points in the text.